Let me talk today about the different gynecological cancer, particularly the deadliest gynecological cancer. Now, there are several forms of cancer in a woman, like cervical cancer, very common in India, uterine body cancer, vulval cancer, vaginal cancer, ovarian cancer, and the breast cancer. Now, the breast cancer usually falls under the domain of general surgeons. Of all the gynecological cancers, the deadliest is ovarian cancer, and I am most frightened of it. And I often tell my patients that be careful of this cancer. Now, to know more about these kinds of topic, please subscribe my channel and click on the bell button so you know when these sort of videos being posted in my channel Rahul Sen archive. Now, the deadliest cancer, why I call the ovarian cancer the deadliest cancer? Now, this cancer grows very, very silently. When it's known, when the diagnosis is there, it's already too late. But before coming to that, I'll tell you that the ovary is a very complex organ. Now, it's a very dynamic and complex organ. It has many, many types of cells, so many forms of cancers and cysts and benign tumors can form in the ovary itself. Compared to ovary, uterus is a far more less complex and a simple organ. Now, let me restrict today on this ovarian part, the ovarian cancer. Why this cancer is diagnosed very late? Because it's mostly symptomless. It grows very, very silently. Hardly any symptom, any problem is felt by the patient. Now, maximum she can feel that bloating of the abdomen, indigestion, etc. Then suddenly the doctor advises an ultrasound examination and there is a growth, there is a solid tissue, a solid tumor in the ovary. Now, there are various forms of cysts. Most are benign. Cysts are a collection of fluid-like material in a sac. But if there is a solid growth in the ovary, especially after 45 years of age, it has to be taken very, very seriously. Along with the ultrasound, there is a special marker in the blood, which is serum CA-125, which can be also done if there is any growth or any sort of suspicious cyst in ovarian image of the ultrasound. If the CA-125, which is a non-specific one, this CA-125 marker can be raised, can be elevated in many conditions, but in ovarian cancer, it's very high. It can be over 100, 200, even 300. So this regular ultrasound examination and the evaluation of serum CA-125 can detect ovarian cancer quite specifically. Now, there is a genetic condition which is known as BRCA1 and BRCA2. These BRCA1 and BRCA2 genes, if present in a family, there would be repeated histories of ovarian, breast, and intestinal cancer in that family. So nowadays we can do BRCA1 and BRCA2, especially if the family shows a history of these sorts of cancer. Somebody with a BRCA1 or BRCA2 genes present have a more predisposition to ovarian cancer, and they have to be regularly checked and must be under very strict vigilance. Now, as I said, there is no symptoms, but an ultrasound examination and a serum CA-125 can tell us that probably she may be suffering from ovarian cancer. Now, once it's been diagnosed, like any cancer, first is the attempt to surgically remove it. Surgically remove as much as possible. Now, all the cancers have stage 4, stage 1, 2, 3, 4. Unfortunately, most of the ovarian cancers are diagnosed at stage 3 when it's quite late. Still, operation is the first choice. Surgical removal is the first line of treatment. Remove as much as possible, and the diagnosis would be confirmed by histopathological examination, which is commonly known as biopsy. What type of cancer, how aggressive it is, how much it has involved the tissues around. Now, after that, chemotherapy is used. There are lots of good chemotherapies nowadays, but as I said, often this cancer is at the advanced stage, and so the lifespan of the patient can be seriously curtailed. So what is important? Most important is to have a preventive measure. Now, it's been seen that those who have less children, they have more predisposition to ovarian cancer. Also, talcum powder, etc., asbestos particles, etc., can lead to the ovarian cancer. So one general awareness that don't put any talcum powder, etc., in your private parts. I tell these patients that these can get implanted in the ovary and can lead to ovarian cancer. Now, the modern gloves which we have now don't have any talc or talcum powder in it because of this very risk. Another condition, as I say, those people who have less children, they have more chance of developing this cancer. But why so? Because the ovulation, the egg release of each month leads to a scar formation, tiny microscopic scar formation in the ovary. Now, those people don't have many children, they ovulate regularly. Those are pregnant quite frequently, they are having pregnancy quite frequently. They have less ovulation because they are pregnant, so the ovary ceases its function, does not ovulate during the 1 year of pregnancy. So more and more of this ovulation, more and more of scarring can lead to this ovarian cancer. So if you can suppress the ovulation, then the less chance of ovarian cancer. If you can persistently suppress the ovulation, less chance of ovarian cancer, and that can be done by oral contraceptive pills. So I am very, very pro oral contraceptive pills. These OC pills have many advantages, but one of the major advantages is that it is a very, very important preventive measure for ovarian cancer, the deadliest cancer. I've seen loads of deaths, loads of very tragic happenings in the patients with ovarian cancer. So I am very pro OC pill. I give the OC pill to many patients so that this ovulation is suppressed on a sustained, persistent basis, and this can lead to less and less of ovarian cancer. If you like this video, please press on the like button, and if you want to know about any topic, please comment below.